A 5-year-old child steps on a thorn in prehistoric France, and within days, she's dead from an infection that modern antibiotics would crush in 72 hours. This wasn't rare. This was normal. For 99% of human existence, a scraped knee could become a death sentence. Childbirth killed 1 in 8 women, and a bad tooth might mean starvation or sepsis. Yet somehow, we didn't go extinct. Somehow, we survived long enough to build pyramids, write poetry, and eventually invent the medicine that makes us forget how recently death was breathing down everyone's neck. The first thing you need to understand is that ancient humans didn't survive because they were tougher or had better immune systems. They survived because the ones who didn't make it simply disappeared from the gene pool, and what's left is us, the descendants of the lucky, the adapted, and the ones who stumbled onto solutions they couldn't possibly understand. Natural selection wasn't gentle. It was a meat grinder. Infant mortality in hunter-gatherer societies hovered around 40 to 50%. Half of all children born never saw their 5th birthday. The ones who made it to adulthood? They'd already survived smallpox, parasites, injuries, and a gauntlet of infections that today we'd handle with a trip to CVS. But they weren't helpless. Archaeological evidence from 40,000 years ago shows Neanderthals chewing on poplar bark, which contains salicylic acid, the active ingredient in aspirin. They didn't know about chemical compounds, they just knew the bark made pain stop. In northern Iraq, we found Neanderthal teeth with remnants of yarrow and chamomile, both plants with anti-inflammatory and antimicrobial properties, and absolutely foul-tasting unless you're desperate. They were desperate. And desperation bred experimentation. Trial and error killed people. Lots of people. Imagine being the first human to test whether a certain mushroom would cure your fever or stop your heart. Someone ate the death cap. Someone else ate the psilocybin. The ones who survived the death cap didn't pass on that knowledge because they were dead. The ones who survived the psilocybin might have thought they met God, but they lived to tell the group which mushrooms were which. Knowledge accumulated one corpse, one coincidence, one survival at a time. Ancient Egyptians performed surgery with copper and bronze tools, including trepanation, drilling holes into living skulls to relieve pressure, or, they believed, release evil spirits. We found skulls with multiple trepanation holes and clear evidence of bone regrowth, meaning the patient survived, healed, and came back for round 2. The survival rate for ancient trepanation was somewhere between 50 and 90%, depending on the era and location. That's better odds than you'd expect for someone taking a hand drill to your head without anesthesia, antibiotics, or even a clear understanding of what the brain does. The Edwin Smith Papyrus, written around 1600 BCE, but likely copied from texts 1,000 years older, describes 48 surgical cases with clinical precision: dislocated jaw, fractured collarbone, compound skull fracture. For each, it lists diagnosis, treatment, and prognosis. Some cases end with an ailment I will treat. Others end with an ailment not to be treated. Ancient doctor speak for you're going to die, and I'm not going to pretend otherwise. They understood their limits. They also understood how to stitch wounds with linen thread, set broken bones with wooden splints and linen bandages soaked in resin that hardened like a cast, and treat infections with a mixture of honey and grease. Honey wasn't a random choice. It's hygroscopic. It pulls moisture out of bacteria cells and kills them. It has a low pH. It produces small amounts of hydrogen peroxide. Ancient Egyptians didn't know any of this. They just knew that wounds dressed with honey were less likely to rot and kill you. The Greek physician Hippocrates, 400 years before Christ, wrote extensively about honey's wound-healing properties. By then, it had been standard practice for millennia. Across the world, the same patterns emerged. In ancient China, they were using moldy soybean curd to treat infections 1,000 years before Alexander Fleming noticed mold-killing bacteria in a petri dish. The active agent was likely a penicillium species. They called it du fu zhang, bean curd, dregs. It worked. They didn't know why. They didn't need to. South American indigenous peoples chewed coca leaves to numb pain and stave off hunger during long treks through the Andes. The active compound, cocaine, is still used as a local anesthetic in modern medicine. They used curare, a plant-derived paralytic poison, on blow darts for hunting and in carefully controlled doses as a muscle relaxant during medical procedures. Australian Aboriginal healers used the larvae of certain flies for wound debridement, placing maggots directly into infected tissue. The maggots ate only dead flesh, cleaned the wound more thoroughly than any tool, and reduced infection. This practice, called maggot debridement therapy, is still used in modern hospitals for certain non-healing wounds. But here's the thing that'll rewire how you think about all of this. Ancient humans didn't just survive despite the lack of medicine. In some ways, their lifestyle protected them from diseases that would later ravage civilizations. Hunter-gatherers moved constantly, never staying in one place long enough for waste to accumulate or for waterborne pathogens to establish themselves. Group sizes stayed small, 20 to 50 people, which made epidemic spread nearly impossible. When someone got sick with something contagious, the group might move on, or the sick person might be left behind with a companion and supplies. Brutal, but it contained outbreaks. Then we invented agriculture, settled in one place, domesticated animals, and everything changed. Suddenly, humans were living in close quarters with pigs, chickens, cows, and goats. Measles jumped from cattle, influenza from pigs and birds, smallpox likely from camels or cattle. We were living next to our own waste, drinking from water sources we also used as sewers. Population density skyrocketed. The first cities were disease factories. Skeletons from early agricultural communities show more signs of malnutrition, infections, and shorter lifespans than their hunter-gatherer ancestors. Agriculture made civilization possible, but it also made us sicker. A hunter-gatherer might live to 45 if they survived childhood. Early farmers? 35 was old age. The trade-off was stability, surplus, and eventually, cities, writing, and specialized knowledge, including medical knowledge. Ancient Greeks didn't just have Hippocrates, they had a whole tradition of rational, observation-based medicine that kicked mysticism to the curb, or tried to. Hippocrates and his followers documented symptoms, tracked disease progression, and attempted to find natural rather than supernatural explanations. They got a lot wrong. The theory of the four humors, blood, phlegm, yellow bile, black bile, was nonsense. But the methodology, the idea that you could observe, record, and learn, that was the seed of everything that came after. Roman military medicine was shockingly advanced. Legionary field hospitals had surgical instruments that wouldn't look out of place in a 19th century operating room. Scalpels, forceps, bone saws, catheters. They performed amputations, removed arrowheads, and treated cataracts. The Roman writer Celsus described ligating arteries to control bleeding during surgery, a technique that wouldn't become standard in Europe again until the 1600s, 1,000 years later. And then Rome fell. The Western Roman Empire collapsed, and much of that medical knowledge evaporated in Europe. But it didn't disappear. It moved east. Islamic scholars in Baghdad, Cairo, and Cordoba preserved Greek and Roman medical texts, translated them into Arabic, added their own observations, and made breakthroughs that Europe wouldn't match for centuries. The Persian physician Al-Razi, in the 9th century, was the first to distinguish between smallpox and measles in writing. He described symptoms, progression, and treatment with such clarity that his text was still being used in European medical schools in the 1700s. Ibn Sina, known in the West as Avicenna, wrote The Canon of Medicine, a medical encyclopedia that systematized all known medical knowledge of the era. It became the standard medical textbook in Europe for 600 years. Islamic medicine gave us the first hospitals as we'd recognize them, institutions with wards, specialized departments, and salaried staff. The Al-Mansuri Hospital in Cairo, founded in the 12th century, had separate wards for different diseases, lecture halls for teaching, a library, and even a music therapy program. Medieval Europe had nothing comparable. While European medicine was still tangled up in religious explanations and humoral theory, Islamic physicians were experimenting with surgical techniques, pharmacology, and clinical observation. But let's jump back further. To the people who had none of this, the tribal groups, the isolated communities, the 99% of human history before writing. How did a woman in childbirth survive when 1 in 8 didn't? Community knowledge. Experienced midwives who'd attended dozens or hundreds of births. Techniques passed down mother to daughter. Herbal preparations to strengthen contractions, ergot from rye, for instance, which contains compounds similar to modern labor-inducing drugs, and also, if dosed wrong, caused convulsions and death. Positioning that used gravity, massage, support. And when things went wrong? Sometimes nothing could be done. Sometimes the mother died. Sometimes the baby died. Sometimes both. But in some cultures, there's evidence of cesarean sections being performed on living women. The Kahun papyrus from Egypt, dated to around 1800 BCE, describes surgical delivery. Whether the mother survived is unclear from the text, but later Roman law included provisions for post-mortem cesarean sections, and by implication, the technique was known. In Central Africa, British explorers in the 1800s witnessed cesarean sections performed with banana wine as an antiseptic and cauterization to control bleeding. The mothers survived at rates that shocked the European observers. Infection was the silent killer. The thing that turned a small wound into a swollen, oozing, fever-inducing nightmare that ended in delirium and death. Without germ theory, ancient healers didn't know what caused infection, but they knew certain practices reduced it. Washing wounds with wine or vinegar, both acidic enough to kill some bacteria. Boiling instruments, keeping wounds covered, using honey, garlic, or onion poultices, all of which have genuine antimicrobial properties we've since confirmed in labs. The ancient Indian text Sushruta Samhita, written around 600 BCE, describes over 300 surgical procedures and 120 surgical instruments. It details reconstructive surgery, including rhinoplasty, nose reconstruction, often needed because nose amputation was a common criminal punishment. The text describes using skin from the forehead to rebuild a nose, a technique so effective that it's essentially identical to methods used today. British surgeons in the 1800s learned the procedure from Indian physicians and brought it back to Europe, where it was hailed as a breakthrough. Dentistry, or the ancient version of it, was horrifying and necessary. Tooth decay has been with us since we started eating grain. Hunter-gatherers had remarkably good teeth. Low-sugar, high-fiber diets kept them clean. Farmers, constant cavities. And a rotten tooth wasn't just painful. The infection could spread to the jaw, the sinuses, the brain. People died from bad teeth regularly, so ancient dentists pulled teeth with crude forceps, sometimes without any pain relief, sometimes with alcohol or opium if you were lucky. The Etruscans made dental prosthetics from gold wire and animal teeth around 700 BCE. Mayans drilled teeth and inserted jade inlays, likely for decoration, but they were drilling into living teeth, which means they had to manage the pain somehow. Pain management was its own challenge. Alcohol, opium, cannabis, coca, every culture found something. The Sumerians called the opium poppy the joy plant 5,000 years ago. They knew. Ancient Chinese physicians used cannabis as an anesthetic during surgery. Dioscorides, a Greek physician in Nero's army, described using mandrake root soaked in wine to render patients unconscious before operations. The dosage difference between unconsciousness and death was razor thin. Some patients never woke up. Broken bones either healed or they didn't. Set properly, immobilized, given time, bone will knit back together. Ancient humans understood splinting. We found Neanderthal skeletons with healed fractures, some quite complex, that could only have mended if the bone was held in place. A broken leg in the wild, for a lone individual, was a death sentence. But in a community, with people who'd feed you, protect you, keep you still while the bone healed, survivable. We've found Stone Age skeletons with severe injuries that healed, including a man who lived years after losing his forearm. Someone kept him alive, someone fed him. Compassion, or at least basic reciprocity, was part of our survival toolkit. Parasites were everywhere: tapeworms, roundworms, hookworms, liver flukes. Mummies from Egypt, South America, and Asia show evidence of parasitic infections. Some parasites were relatively harmless. Others caused anemia, malnutrition, organ damage. Ancient texts describe worm remedies, pumpkin seeds, wormwood, pomegranate bark, and modern analysis confirms these plants contain compounds that paralyze or kill intestinal parasites. Malaria killed more ancient humans than almost any other single disease. Entire civilizations rose and fell, in part based on whether their territory was malarial. Ancient Chinese texts describe the cyclical fevers characteristic of malaria and recommend qinghao, sweet wormwood. The active ingredient, artemisinin, is now the frontline anti-malarial drug worldwide. They didn't isolate the compound, but they knew the tea made from the plant could break fevers. Ancient humans were also dealing with things we've completely eradicated or controlled: leprosy, plague, tuberculosis, smallpox. These diseases shaped history, toppled empires, killed kings, and left scars on entire populations. The Black Death in the 1400s killed a third of Europe, but plague had been around much longer. The plague of Justinian in 541 CE killed tens of millions and likely contributed to the fall of the Eastern Roman Empire. Smallpox wiped out entire indigenous populations in the Americas after European contact, not because the indigenous people were weaker, but because they had no prior exposure and thus no inherited resistance. But smallpox also gave us the first glimmers of immunology. Variolation, deliberately infecting someone with a mild case of smallpox to protect them from a severe one, was practiced in China and India for centuries before it reached Europe. You'd take pus from a smallpox blister, dry it, grind it into powder, and blow it up a healthy person's nose. Or you'd scratch it into their skin. They'd get sick, but usually not fatally, and afterward, they'd be immune. It was risky. Some people died from the procedure, but when smallpox killed 30% of those infected, a 5% fatality rate from variolation was a gamble people took. So when you step back and look at the full picture, ancient humans survived without modern medicine because they weren't without medicine. They had medicine. It was limited, dangerous, inconsistent, and often based on trial and error rather than understanding. But it was there, passed down through generations, refined by necessity, guarded by healers, shamans, midwives, and physicians who held the accumulated survival knowledge of everyone who came before. And the ones who didn't survive? They're the invisible majority. The children who died before their first words, the mothers who bled out, the hunters who got infections, the elders who succumbed to diseases we can't even identify from their bones. They didn't make it, but enough did. Just barely enough, generation after generation, clawing through infection and injury and ignorance until we finally figured out what germs were, how surgery should work, and that washing your hands could save more lives than any herb or prayer. We stand on a mountain of the dead who taught us, one tragedy at a time, how not to join them.